Hello, everybody. I am Dr. Shehla Shaikh, consultant endocrinologist at Sefi Hospital and Wokard Hospital. And today I am going to talk about a patient with newly diagnosed type 2 diabetes with a high baseline HbA1c. Mr. AB was a 45-year-old gentleman with newly diagnosed diabetes who had visited the clinic 6 months back. He has multiple other comorbidities like he's obese, he's hypertensive, he has dyslipidemia. At that point of time, he was initiated on metformin with lifestyle modification, and recently he came back to us for routine follow-up. His lab investigations show that his sugars are still not controlled. He has an HbA1c of 8.5 with eGFR of 80 ml per minute per 1.73 meters square, and his triglycerides are 200. With an LDL of 80. He's been metformin 1000 milligram twice a day, lisinopril once a day, metoprolol once a day, atorvastatin 20 milligram once a day, and aspirin. He is obese still. He has a BMI of 31 kg per meter square, but as far as blood pressure and other parameters are concerned, he is well controlled. At this point of time, evidence shows us that early intervention and achievement of good glycemic control reduces the risk of long-term micro and macrovascular complications in our patients with type 2 diabetes. UKPDS very categorically showed a legacy effect of early intensive therapy because it was seen categorically that a difference in CV events 10 years post-trial were apparent even though there were no differences in the HbA1c levels at that point of time between intensive and conventional therapy. When metformin is not suitable and EMPA or LINA is being considered as an alternative first-line therapy, combination therapy may be considered so that you are able to achieve targets quickly, more safely, especially in patients with higher baseline HbA1c levels, especially in patients who are obese, especially in young patients who would do well with early control so as to be able to reduce the risk of long-term micro and macrovascular complications. Early combination therapy does make a lot of sense at this point of time because there is a meta-analysis that shows early use of combination therapy definitely significantly increases the likelihood of achieving the glycemic target of less than 7%, compared with metformin monotherapy. For patients with an HbA1c more than 1.5% above goal at diagnosis, all our professional bodies, be it ADA or ESD, recommend first-line therapy with a dual combination and an SGLT2 inhibitor as the first post-metformin therapy in patients with established CVD, CHF, or CKD. EMPA and LINA, as we all know, is a combination with complementary mechanisms of action and pleiotropic benefits which may be suitable across a broad range of patients, including those with established ASCVD or high-risk established HF or CKD, due to tolerability of the combination in addition to the potential benefits of EMPA on CV and renal outcomes and no increased risk of heart failure with either agent. And of course, as we all know, that early achievement of HbA1c less than 7% with this combination would help us reach target HbA1c at 12 weeks compared to monotherapies. A1c reduction by this combination, you almost have an HbA1c reduction of almost 1.8% in patients at 24 weeks when this combination is added in patients who are already on metformin. The benefits on glycemic control are maintained, so this combination does work well even at week 52, and a higher percentage of patients achieve an HbA1c less than 7% with this combination. So yes, this is a suitable component and strategy to achieve target HbA1c without increasing the risk of hypoglycemia. And also it does cause weight loss because this combination is going to cause weight loss with an improvement in the overall lipid profile. A reduction in the incidence of genital infections has been seen when this combination is used vis-a-vis when SGLT2 inhibitors are used alone, perhaps because of a better glucose control, though there are a number of other potential mechanisms which still remain to be understood and investigated. So when we are talking about the EMPA-LINA combination, definitely robust HbA1c reduction, 2 to 4 higher odds of patients receiving the goal compared to individual agents with low hypoglycemia risk, with weight loss, with other pleiotropic benefits, and a well-tolerated combination. Thank you very much.